Welcome to Satu Carry 2.0 online nursing channel. In today's video, we brought some of the important and interesting questions for DSSSB Nursing Officer Exam 2019. We are going to see questions in various aspects like reasoning, general knowledge, general awareness, current affairs, English, and as well as various nursing specialities. So don't skip the video, watch all the 50 questions in this video so that it is going to be helpful in the future for any nursing officer exams when you are going to appear. Before watching these questions, please subscribe to our channel if you have not yet subscribed. Also click the bell icon to get the latest notification about all the new videos. Let's say the first question of the day. In the investigation of an epidemic, you compare the present frequency at this time of the year in this community. This is done during which stage of the investigation? Option A, establishing the epidemic. B, testing the hypothesis. C, formulation of the hypothesis. Option D, appraisal of facts. So in epidemiological research, so the comparison is done in a stage. That stage is called establishing the epidemic. Now let's see the second question. Population focused nursing practice recurs which of the following process? Option A, community organizing. B, nursing process. C, community diagnosis. D, epidemiologic process. So population focused nursing practice needs the community diagnosis as the nursing process. Question number 3. The typology of family nursing problems is used in the statement of nursing diagnosis. The youngest child of the Rajus family has been diagnosed as mentally retarded. This is classified as option A, health threat. B, health deficit. C, foreseeable crisis. Option D, stress point. So in a typology of family of nursing problem, the Raju's family, a child is suffered with mentally retarded. So this is classified under the concept option B, health deficit. Now let's see the question number 4. All of the following facts about chicken pox are true except option A, incubation period is about 15 days. Option B, rashes are superficial. Option C, centrifugal distribution of rashes. Option D, rashes mostly in the flexor surfaces. So which of the fact regarding chicken pox is true except? The right answer is except the three things. One is true, that is centrifugal distribution of rashes is noted in chickenpox client. Question number 5. The National Family Welfare Program in India was launched in which year? Option A, 1951. B, 1958. C, 1962. Option D, 1965. The National Family Welfare Program in India was launched in the year 1951 is right. Question number 6. The most common type of dementia is option A, alcohol induced dementia. B, Alzheimer's dementia. Option C, frontotemporal dementia. Option D, Parkinson's disease. A common type of dementia in our country is senile dementia, that is also called Alzheimer's disease. Next question. The natural sedative in milk and milk products, particularly in warm milk, that can induce sleep is A, flurazepam. Option B, temazepam. C, tryptophan. D, methotrexate, so which is called natural sedative, which is present in warm milk and milk products, which can induce sleep. The right answer is temazepam is a natural sedative agent. Question number 8. To institute appropriate isolation practices, the nurse must first know the option A, organism's mode of transmission, option B, organism's gram staining characteristics, option C, organism's susceptibility to antibiotics, option D, patient's susceptibility to organisms. So to initiate isolation practice, the nurse should know first about organisms mode of transmission. Then only what type of specific isolation practice needed can be implemented. Question number 9. A patient must receive 50 units of Humulin regular insulin. The label reads 100 units is equal to 1 ml. How many milliliters should the nurse administer? Option A 0.5 ml, option B 0.75 ml, option C 1 ml, option D 2 ml. So 100 unit is equal to 1 ml. So 50 unit you need to administer. Then how much ml? That is 0.5 ml. Question number 10. Nurse Meena teaches a patient with heart failure to take oral furosemide in the morning. The reason for this is to help. Option A, retard rapid during absorption. Option B, excretes excessive fluids accumulated at night. Option C, prevent sleep disturbances during night. Option D, prevention of electrolyte imbalances. For what reason the nurse Meena advises the patient with heart failure to take oral furosemide in the morning time? The right answer is option C, to prevent sleep disturbances during night. If furosemide is taken at night time, patient has to get up from the bed frequently to go for urination. So to prevent that, the nurse Meena advises the patient to take furosemide in the daytime. Question number 11. The characteristic symptom of hyperkinetic syndrome is option A isolation, B decreased attention span, option C impaired memory, option D frowns. So which is the specific symptom present in hyperkinetic syndrome? So child with attention deficit hyperactivity disorder will have decreased attention span, which is a classical symptom of hyperkinetic syndrome. Question number 12. The bone remodeling hormone is option A vitamin D, B thyroxine, C parathormone, option D calcitonin. Which hormone is called bone remodeling hormone? The right answer is option D calcitonin. Question number 13. Nurse Manju is assigned to care for a client who has returned to the nursing unit after left nephrectomy. Nurse Manju's highest priority would be option A, hourly urine output, option B, temperature, option C, able to turn side to side, option D, able to sift clear liquid. So for a client who returned to a nursing unit after left nephrectomy, the nurse's highest priority is to monitor the urine output hourly. That gives a clear information. whether the renal system is functioning properly or not. Question number 14. Ramesh, who has undergone mitral valve replacement, suddenly experiences continuous bleeding from the surgical incision during postoperative period. Which of the following pharmaceutical agents should Nurse Sunita prepare to administer to Ramesh? Option A, protamine sulfate. Option B, quinidine sulfate. C, vitamin C. Option D, comedine. So for a client with mitral valve replacement who is having continuous bleeding in his postoperative period, the pharmaceutical agent to be administered will be protamine sulfate. Question number 15. Nurse Pihu is evaluating the renal function of a male client. After documenting urine volume and characteristics, Nurse Pihu assesses which sign is the best indicator of renal function. Option A, blood pressure. B, consciousness. C, bladder distension. Option D, pulse rate. So the important sign which is the best indicator for best renal function will be assessing the blood pressure. Blood pressure tells how your kidney functions, whether it is normal function or abnormal function. Question number 16. A female client is experiencing painful and rigid abdomen. She was diagnosed with perforated peptic ulcer. A surgery has been scheduled and a nasogastric tube is inserted. The nurse should place the client before surgery in option A, Sims position, B, supine position, C, semifowler's position, D, dorsal recumbent position. So when a client is having perforated peptic ulcer, before surgery, when a client is in nasogastric tube, the best position given for the client is semifowler's position. Question number 17. A newly admitted client is diagnosed with Hodgkin's disease, undergoes an excisional cervical lymph node biopsy under local anesthesia. What does the nurse assess first after the procedure, followed by the cervical lymph node excisional biopsy? The nurse must assess which of the following. Option A, vital signs. B, incision site. C, airway. And D is level of consciousness. So the priority goes to airway assessment. Question number 18. Nurse Roji teaches a client who has been recently diagnosed with hepatitis A about untoward signs and symptoms related to hepatitis the that may develop. The one should be reported immediately to the physician is option A, restlessness. B, yellow urine. C, nausea. D, clay colored stools. So which one should be reported immediately to the nurse related to the hepatitis symptom which may develop? The right answer, then because of hepatic obstruction, the clay colored stool can be developed. So that must be immediately reported to the nurse. Question number 19. Jitin has undergone subtotal gastrectomy. The nurse should expect the nasogastric tube drainage will be what color for about 10 to 24 hours after the surgery. So when a client undergone subtotal gastrectomy, when a nasogastric tube drainage is seen for its color 10 to 24 hours after surgery, which color you will expect? Option A, bile green. B, bright red. C, cloudy white. Option D, dark brown. Right answer is dark brown color is noticed. So that indicates normal finding. Question number 20. Tarun has diagnosed with appendicitis. He develops a fever, hypotension and tachycardia. The nurse suspects which of the following complications? Option A, intestinal obstruction. B, peritonitis. C, bowel ischemia. Option D, deficient fluid volume. So for a client who was diagnosed with appendicitis, who have fever, hypotension and tachycardia, the nurse can expect for the complication of peritonitis. That is the first complication to be noticed in client with appendicitis. Now let's see some of the questions from reasoning. In the following questions, select the related words from the given alternatives. Banana is fruit. Similarly, ginger is what? Option A, root. B, flower. C, fruit. D, stem. So ginger is root. Question number 22. In the following questions, select the related number from the given alternatives. 10,001 is 10101. Similarly, 101 is what? So you have option 11, 201, 100, 121. So very simple. Let's see the answer. The right answer is option B. So from 10,001, when you add 100, you are getting 10101. Similarly, from 101, you add 100, you get 201. Question number 23. In the following questions, select the related letter from the given alternatives. FHK is equal to DFI. Similarly, how you can write OQT from this four option? Option A, NPS. B, PRT. C, MOR. Option D, QSB. Okay. Now you work out, then you can see the correct answer here. The right answer is MOR. So very simple, minus 2 of all the letters. So F, and you are having D. So that is EF. So when you minus 2 letter, that you from the F you are getting D. From the H you are minus 2 letters, you get F. From the K you minus 2 letter, you get I. Similarly, from the O you minus 2 letter, you get M. So the MOR is the right answer. Question number 24. Select the odd one from the given alternatives. Option A, CEF. Option B, LNO. Option C, RTU. Option D, GIK. So which one looks different from this four? Initially, when we see, all the four looks different. When we think again and again, we can get a clue. The right answer, let's see. GIK looks different. You see the letters like CEF, so that is plus 2 from the C, the second letter is E, and plus 1 series. So from the E, the when you add 1, you are getting F. Similarly, LNO, RTU, but GIK we are not getting in this series. So that is add 1 here. Question number 25. Select the add one from the given alternatives. Very easy. Trousers, pants, shirts, shorts. So the add one here is shirts. It's used to wear in the upper body, whereas all others are used to wear in the lower part of the body. Question number 26. Select the odd one from the given alternatives. We have four numbers. Which number is different in this four? Option A 145, option B 463, option C 581, option D 651. So among this, the odd number is option B 463. You add all the numbers in given number. 1 plus 4 plus 5, you are getting 10, which is even number. 5 plus 8 plus 1, you are getting 14, that is even number. 6 plus 5 plus 1, you are getting 12, that is even number. But when you are adding 4 plus 6 plus 3, you are getting 13, that is odd number. So this is the odd one in the following numbers. Question number 27. From the given words, select the word which cannot be found using the letters of the given word. So a word is given here, smoothers. From this word, which option given in the alternatives will not be made from the letters given in this word, smoothers? Option A, those. Option B, metro. C, store. D, tears. So there is no A in this smoothers. So the right answer will be option D. Very simple. Question number 28. If Frisk is coded as HTKUMGF, then how you will code sun? Option A UWPC, option B RGZ, option C KMJ, option D ZBF. So how you can code the sun similar to that of Frisk? So very simple here. So plus 2 series you can check again, like F, you are getting the second number, second letter from the F is H. From the R, the second you are getting T. So use the same trick. So from the S, the second one will be U. From the U, the second, that will be option A will be right. Question number 29. So read the question carefully. In certain code language, plus represents multiplication symbol, minus represents plus symbol, x represents division symbol, and division symbol represents minus. What is the answer to the following question? 80 plus 2 divided by 25 plus 5 minus 10. So which answer you will get when you put for the plus? So what is the plus? Plus represents x. So 80 into 2. So division represents minus. So 80 into 2 minus, like this when you put, what number you are going to get? A is 35, B is 98, C is 36, D is 45. So when you do like that, you are going to get the answer as 45 is the expected answer. Now let's see the question number 30. Arrange the given words in the sequence in which they occur in the dictionary. Option A, clock light. B, cloudier. Sorry, you have the five words. So arrange these five words in the order as you get in the dictionary. So which one will be right, you think? So arrange in the order. So in the dictionary we will get in this order 1, 5, 2, 3, 4. So you have that clock, that is 1, CLOC. So C comes first, then the you K is in both, but W is here and there is L in the 1 and 5. So L will come first in the dictionary. So like that when you arrange, this will be the right answer. Now let's see some of the general knowledge question. So, in which country would you find Mount Kilimanjaro? Kilimanjaro. Option A, Tanzania. B, South Africa. C, Brazil. D, Switzerland. Kilimanjaro. Kilimanjaro is seen in Tanzania, African country. Question number 32. Old Trafford Cricket Stadium is located near which major city? Old Trafford Cricket Stadium, where India played Pakistan in the ICC 2019 World Cup. Option A, London. B, Sydney. C, Manchester. D, Bristol. Right answer is Manchester City is having Old Trafford Cricket Stadium. Question number 33. Which country is the leading egg producer in the world? Option A, India. B, China. C, Russia. D, Spain. The leading egg producer in the world is China. Second will be India. Question number 34. Among the following Indian idols, who has won the Nobel Prize? Option A, Amartya Sen. B, APJ Abdul Kalam. Option C, Satyajit Ray. Option D, Mahatma Gandhi. So Nobel Prize was given to Amartya Sen for economy. Others have not awarded the Nobel Prize. Question number 35. The highest gallantry among these is option A, Shaurya Chakra, B, Kirti Chakra, C, Mahavir Chakra, option D, Paramveer Chakra. So these are the medals given for soldiers and soldiers' family members for doing any brave things. Recently, Abhinandan was awarded one of this award. We know Colonel, Lieutenant Colonel Abhinandan, which is the highest gallantry among this. Option D, Paramveer Chakra. So it is in the order from the bottom. The first, second will be Mahavir Chakra, third Kirti Chakra, and fourth Shaurya Chakra in the rank. Question number 36. Which state will host the third edition of Kelo India in 2020? Option A, Punjab. B, Haryana. C, Assam. D, Kerala. Kelo India 2020 will be hosted in Assam. Question number 36. Scholars of which university has developed the Care for You app for elderly people? Option A, IIT Kharagpur. Option B, IIT Bombay. C, IIT Kanpur. Option D, IIT Madras. So Care for You app for elderly people. It gives information and it helps to prevent the falls of the elderly people. Is designed by scholars of IIT Kharagpur. Question number 38. Which drug has been banned by the health ministry that was being used in the poultry industry for producing animals, aquafarming, etc.? Option A, Tylosin, B, colistin, C, penicillin, D, azithromycin. So most of the chickens which we are eating in our house and in the hotels are given this drug, which is going to cause more side effects in the human beings. Which is that drug which is burned by health ministry? The drug which is burned is colistin. Question number 39. Bhushan Harichandan is the new governor of which state? Option A, Odisha. B, Madhya Pradesh. C, Andhra Pradesh. D, Jammu and Kashmir. Bhushan Harichandan from Odisha. The ex-veteran BJP member is the governor of Andhra Pradesh. Full-time governor for Andhra Pradesh. Question number 40. Who will be the new Prime Minister of the United Kingdom, England? Option A, Michael Gove. Option B, Jeremy Hunt. C, Nigel Farage. Option D, Boris Johnson, the Prime Minister of England, who was recently elected, was option D, Boris Johnson. Now let's see question number 41. From nursing, we are going to see another five more questions. A client with multiple sclerosis plans to begin an exercise program. In addition to discussing the benefits of regular exercise, the nurse should caution the client to avoid activities which option A increase the heart rate, B lead to dehydration, option C or consider aerobic, option D may be competitive. So which action to be restricted, which activity to be restricted when a client is diagnosed with multiple sclerosis? The right answer is the activities which leads to dehydration should not be entertained by the nurse for a client who is diagnosed with multiple sclerosis. The client should be well dehydrated during the activity and before the activity. Question number 42. A, a 35-year-old male has been an insulin dependent diabetic for 5 years and is now unable to urinate. Which of the following would you most likely suspect? Option A, atherosclerosis. Option B, diabetic nephropathy. Option C, autonomic neuropathy. Option D, somatic neuropathy. So for this client, we can expect the client to have the complication of diabetes as autonomic neuropathy. Option C is right, which can affect the bladder. As a result of that, the client cannot pass the urine very easily. The bladder cannot contract because of autonomic neuropathy. Question number 43. A second year nursing student has just suffered a needle stick while working with a patient that is positive for AIDS. Which of the following is the most significant action that nursing student should take? Option A, immediately see a social worker. B, start prophylactic AZT azithromycin treatment. Option C, start prophylactic pentamidine treatment. Option D, seek counseling. So when a student who got needle stick when working with a HIV/AIDS patient, he should be starting the prophylactic of antiretroviral treatment. A is a T. Question number 44. A toddler is 26-month-old and has been recently admitted to the hospital. According to Erickson's, which of the following stages is the toddler in? Option A, trust versus mistrust. B, initiative versus guilt. C, autonomy versus shame and doubt. Option D, intimacy versus isolation. So 26-year-old uh, toddler. So he should have the Erickson's autonomy versus shame and doubt stage. Question number 45. A 87-year-old female has recently been admitted to the hospital with increased confusion and falls over last 2 weeks. She is also noted to have mild left hemiparesis. Which of the following test is most likely to be performed in case of hemiparesis? Option A, full blood count. Option B, ECG. Option C, thyroid function test. Option D, CT scan. So very simple. In hemiparesis, the diagnosis can be done with CT scan. Question number 46. Now the psychiatric question. The superego is the part of the psyche that option A use defensive function for protection. Option B is impulsive and without morals. Option C, it determines the circumstances before taking decisions. Option D, the censoring portion of the mind, the superego. So, which is the activity done by superego? The right answer is superego censors the activities of our mind. So, it tells which one we should do, which one we should not do, which is right, which is wrong. The first one is done by id. The second one is done by this one ego. Third one is also done by ego. First one by ego, second one by id, third one by ego, fourth one by superego. Now let's see some of the English questions. In the following questions, sentences are given with the blanks to be filled in with an appropriate words. Four alternatives are suggested for each question. Choose the correct alternative out of the four as your answer. So the sentence is given and you have to fill the appropriate word from the alternatives. People who dash have a fast walking pace are more likely to live longer than their slow walking peers, a study claims. Option A strangely, B habitually, C rarely, option D dreary. So the answer will be habitually. Habitually, by the way of habit, customarily, use or repeated. So these are the synonyms for this. Dreary is opposite. It is depressingly dull and bleak or repetitive. Hence, option B is correct for this choice. Next question. Out of the four alternatives, choose the one which best expresses the meaning of the given word buff. You must know the meaning of the word buff, then only you can select the right answer from this four alternative. Option A injure, B burnish, C incite, option D insult. So buff means option B burnish, that is called polish. Burnish means polish something, especially a metal by rubbing. Hence buff and burnish are synonyms to each other. Question number 49. Four alternatives are given for the idioms printed in bold. Choose the alternative which best expresses the meaning of the idiom phrase. Option A, the which is the idiom given here is the bee's knees. The bee's knees. So, which is the meaning for the idiom or the phrase the bee's knees? Option A, to be annoying. Option B, to be excellent. Option C, to be a criminal. Option D, to be a destitute. The right answer is option B, to be excellent is the meaning for the idiom the bee's knees. So the bee's knees means exceptionally great, excellent or high quality like you all people. Question number 50 is a subscriber challenge question. You have to write the answer for this question in the comment section. When Jallianwala Bagh massacre took place? Option A 13th April 1918, B 13th June 1919, option C 13th April 1919, option D 13th April 1920. So right answer should be commented in the comment section here. So here we have seen 50 questions. Hope all the questions are very interesting and you enjoyed all the 50 questions. We will this will be going to benefit you. We will meet again with another good questions very soon. So thanks for all for watching this video. And if you like this true video, please click the video and you can watch it. Thanks for watching this video. Take care. Bye bye. Good night.